Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 18, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place. The meeting of the Hubbardston Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found at www.hubbardstonma.us. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event we are unable to do so, despite best efforts, we will post on the town's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting.
The only item on the agenda is an update. Judy, take it away.
Okay. So we have a couple of options here for clinics right away. The Board of Health in Rutland, I was sat in on their meeting last night, and they have 600 doses available to share with the 12 towns that have joined in with them. And the 12 towns are kind of scattered all over the place. They run from Sterling to New Salem. So it's kind of interesting as to who signed on. But Rich Stevens, because I've worked with that Board of Health for over a decade, helping run their clinics, he said, I have total trust that you can pick up the vaccine and bring it over to Hubbardston and set up a clinic for the first responders right here in Hubbardston, right in their own backyard, rather than have them sign on and pick an appointment and then go over. Now, well, their clinics are going to be by appointment. They're going to be, my understanding is at the fire station, because they have a drive-through a capability, so they just drive right through the station and they don't have to get out of their car or anything. Now, this is the Moderna vaccine, so that it takes care of your first responders, your police and your fire department. They do have the 600 doses, which is, I was surprised to see that it was already in their freezer, because the state was saying that they didn't expect it to arrive until yesterday. So it was a little surprised that they already had it. It was already distributed. So the state is like a little bit ahead of themselves. That's new. But anyway, so that's the update on EMS at this time, and first responders. Their clinics are going to start running next Monday. They're going to be Monday through Friday from 2 p.m. to 8 p.m. And they're going to be also on Saturday morning from 8 to 4. So that gives the police and fire department plenty of time to go over there, or we can set up, mini satellite over here. So it is the Moderna one. My understanding from the EDS that I attended in Quabbin was that this had to be, it came in powder form and it had to be dissolved, but Rich is saying that the packages look like it's already pre-mixed. Yay, from a nurse's perspective, yay.
Right.
And the only question I had, everything's coming pre-packaged, the needles, everything. We just still have to provide, alcohol and hand sanitizer, gloves and things like that. So those are the supplies that we would have to supply. It's going to be the same thing. Now, when we start moving towards, according from what I've heard from EDS drills, the DPH, and from what I heard last night, they may actually be a little bit ahead of the game for starting the clinics for the general public. So Again, it'll probably, we may end up using Rutland all the way through because, you know, like they bought extra refrigerators, they bought extra freezers, and they have no problem storing it for any town that needs it to be stored for them. But it looks like we're definitely on target for March to start moving into providing clinics for seniors, etc. And a lot of the senior groups, you know, they're, I've been getting some calls already asking about satellite clinics to senior housing. So we've already talked about that, so we're kind of already one step ahead of it. But it, you know, the Board of Health will need to set that up because this is going to be state, federal vaccine, and you know, this at this present time, pharmacy is not going to be doing general public other than in their stores. If they get it for that. I haven't heard any plans on pharmacy status beyond going in and providing vaccine or providing service to distribute the vaccine at the nursing homes. So the other day DPH said that they had phase 2 plans. They had not completed them yet, so they only had gone as far as phase 1, which is basically your EMS and first responders and your healthcare professionals. So those plans are still in flux, and they haven't even talked about phase 3. So that's where I'm at. That's the update I have. We probably need to look at number one, make sure that we have supplies, you know, pull a checklist out of that EDS thing and look at our supplies. Somebody needs to go and look and learn MIS and the there's a new database the training is coming up, and I forget what the name of it is, PrepMed or something like that. That is they're starting trainings. They just started trainings on Monday for that, and we need to get in on that. And and a number of people can get in on that training as well. So we need to MIIS. My understanding is that PrepMed will connect with MIS. So if you put the data into PrepMed, then you'll be able to it'll automatically populate in MIS. At least that's what we're being told. So we'll see when it comes. But their trainings just started this week, and there'll be trainings all spring. So 2 or 3 of us need to get in on it. It's basically an entry database type of situation. Let's see. So we probably need to look at what we need for supplies. We need to decide what kind of clinics we want and what kind of relationship we're going to have with Rutland for getting vaccine. And since they've offered to store it for anybody that wants it stored, they just need to know because, like I said, they have 600 doses based on about 300 responders for the area. But the way DPH said, they're passing it out in small increments. But if you need more, if you go through it and you have more volunteers or more responders to that need the vaccine, then they'll distribute it. So they have a lot, but they're just distributing it in small increments because it has to be, you know, frozen and defrosted and all that stuff. So you guys have questions?
I have a
So
few.
Mallory,
Go ahead.
just
my first question is back to Mallory as to how many people in Hubbardston are first responders. What's our numbers?
We got the numbers back from the chiefs, and I think it was about 21 that said they wanted to get vaccinated. Not everyone wants to get vaccinated, so.
Yeah, about 20, they're finding about 20, well, they said 23%. I don't know how they came up with that number, but so about, 25% are saying they don't want to be part of the program, which I think is foolish, but
I think our number is a little higher than that.
Wow.
So when they get COVID and they're miserable and they're out of work for 3 weeks, don't look to me for sympathy.
Yeah, same here.
So,
With a number of 21 and the number of clinic days that Rutland is going to offer next week, it seems that we should ask our guys and gals to go to Rutland.
That's what I was thinking. If we try to organize something here, we're going to have a lot of hard time because we have part-timers who work different towns, different shifts. So we can give them some options, which it sounds like Rutland is going to make available. That might be our best option right now.
Okay, I'll find out from Rich because he's still working on all those details about, signing up and everything. But
Right, have him send emails to you and Mallory so Mallory can let all the employees and worker, all those first responders know how to go about it.
Yep.
Yeah. All right, so then what we need to get ready for is seniors.
seniors and the general public.
Right. I communicated with Jill, the principal at the elementary school. If we want to do an EDS drill with Jamie during the week, it has to be starting at 6:30 p.m. There's no additional cost to us because there's janitors on duty throughout the evening. She just needs to know a few days ahead when we want to do that. I explained that for this drill, it would be a matter of just coming in the hallway to the cafeteria, looking at the cafeteria and the gym area and running and, walking through all the parts that we need for the drill. So that's all okay. If it's during the week, it has to start at 6:30 after the kids are gone. She thought it would be useful to do a Friday night because then there's no kids in the building for 2 days. And, germs, if there's any germs, they'll disappear.
I don't think she's quite getting the concept, but the other option we have is because Colleen and I were over at the EDS drill for Quabbin. Jamie said that she would count that as our EDS for the year. So that she would give us credit for participating and setting up an EDS drill for the year. So we may not even have to do all that walkthrough unless we all want to do it just for our own purposes. But the other option that she offered was to do a Zoom meeting and then sit with everybody and just go over what she has from the DPH side. So she offered that as well. In fact, she penciled in January 11th as a Zoom meeting for us.
Okay.
Well, I have a few questions if.
Go right ahead, Vin. Sorry.
Okay, so this section on well, let's start at the beginning. If we have 600 doses in Rutland and they're going to share it with 12 towns, that gives us approximately 50 per town. Now, obviously, many of these towns won't need 50, but do we, even if we have 21 responders, first responders, the second question I have is, or the first question I have is, we are going to conduct clinics here in town. Do we want to make sure the people who are running these clinics fit into this 50 dose? I'm just using that as the example dosage right now. If we have 50, then if we have people running these clinics, they need to have some type of protection as well. Are they going to be able to fit into that 50 dose or rather than
Yeah,
coming right into the, I mean, I think
Yes.
we have to account for these
right,
doses.
right. And actually, Rich, or Scott, rather, Scott, the chairman of the Board of Health over there, and he called me and said to line up my volunteers. So all my volunteers that go over, he wants 2 or 3 of us every night and on Saturday. So if you are a volunteer, even if you're just checking people in and you're doing, any kind of data collection, you're acting as a clerk over there, you get a shot automatically. You are offered a shot. So any volunteer, no matter what position, whether you're a nurse or a clerk, you're eligible to receive the vaccine.
All right, so do we have a list of them ready?
From Hubbardston,
Yeah.
I don't think we have anybody specifically from the town of Hubbardston. From the MRC, I already have 12 volunteers on my list.
Okay, so that
But
gives
are
it,
they residents of Hubbardston or not?
But they're no, some of them are, most of them aren't. But that's going to be calculated from the Rutland side, not from the Hubbardston side.
okay. So I think we need then to start, since we have everybody present for the Board of Health, maybe we should start right here. If we're going to be volunteering, which many of us may, I think we have to put our names down and get it ready for that. So that we can coordinate the same type of schedule. There's no sense in making 2 or 3 appointments. If we have to do that with the first responders, we should be included in that, as well as anybody else in the public from Hubbardston that may want to volunteer for this clinic. This is going to be a very intense situation for everybody. So I
Right.
think we need to make sure that happens. But I do have a concern about the people who may not want to take these shots, these first responders, because there seems to be consequences to that, especially where they're responding to any type of situation that may prove to be contagious. Are we worried about that? Do we need to plan for anybody who may refuse this type of inoculation and what happens after that? It seems to me like it's a no-brainer, but I guess that's up to other people. But when they're employed by the town and they're working with people who may be susceptible to catch this situation, I think the town has to bear a little bit of responsibility if they're not, especially if they're going to be out of work for 3 weeks.
Ryan is
Just
working
a
with
thought. I
town
don't
council
have
on
an
that.
answer to that right now, but that's something that we need to consider.
Vin, did you hear Mallory's response?
I did not.
Ryan is working with town council on that right now.
Well, good. That's good news. All right.
The council, what do you mean by that?
Legal counsel.
Legal.
Oh,
Legal.
okay.
Yeah, similar things are
Yeah,
happening
just
even in business and industry. My husband works for a healthcare adjacent company. They do healthcare. They correct, fix machines, go into hospitals and labs, and they require people to be up to date on vaccinations to be hired. There are people within their organization that are refusing the vaccine, and they're being told that they can do that, but if they suspect they've been infected or exposed, and they need to take time off to be tested and quarantine, that they'll do so without pay. So whereas up till this point, they've been told, take the time you need and we'll just cover it, don't have to take off time. They're now being told either you get vaccinated or any time you need to take off will be at your own cost.
Yes.
Wow.
Yeah.
I know it, when I worked at UMass, we were mandated to get the influenza. But and the only way you got out of it is if you were allergic to eggs.
There you go. All right, Vin, any other questions? All right, I have a couple. So the supply checklist, do we want to delegate that? And the MIS database and the training, do you have an email where we can sign up for that or the information?
I can
Yeah,
get that.
I'm tracking that down too. Mallory, do you have it?
I should have it somewhere. I can track it down here.
All right. I would like to sign up for that.
Okay.
I did.
Yeah, I would too.
I did look at signup.com. I don't know, obviously for this first phase, if our first responders are going to go to Rutland and that works out, we won't need the sign up sheet, but we will for the general public.
Yeah.
I created a test, which I can send out via email so you guys can look at it, just to give you a sense of like the information that it presents on the screen to the end user. I think what'll be tricky with the signup.com is that it lets you sign up for, like as an individual, you log it, you go in, create a free login, sign up for a slot. There's options to allow people to sign up for more than one slot for different members of their family, which we need to decide if we want to be able to do that. You have required fields. You can require things like name, obviously, email and phone number, which I don't know what else we may need to require, if anything. And then there's information that you present to the user when they log in, like welcome to the COVID-19 vaccination website, sign up form below, blah, 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 blah. But I'll send it to you guys so you can see it and look at the test that I created. It's pretty straightforward. The issue is that I need to know how long it's going to take per person, because they have to sign up for a time slot, and it's going to include them checking in. You have to like kind of figure that out. How is it half an hour? Is it 20 minutes? Is it 45? Like how long should that be? You can create, say, 6 signups for, if you have a 12 to 2, you could create 6 signups or 8 signups for a half an hour, whatever. For that time period, and then repeat it every day. And people can just pick a time period. The trick is going to be, so with this vaccine, it's 1 shot, correct? With the Moderna?
2.
It's 2.
2.
Moderna's 1.
So the second, if they need a second,
No, Moderna's 2.
Moderna's 2.
Yeah.
If they need a second shot, there isn't a way that I can tell within the tool where they can sign up for a second appointment X amount of weeks later. So I think what we're going to end up having to do is, like, let's say we have a phone number people can call to sign up. Maybe they're not web savvy. Whoever is doing the signups is going to have to use that web form, the sign up form, and sign them up, do the data entry for them. When they check in, we're going to have to give them their second appointment and sign them up for the second appointment.
Right.
That's what I was going to suggest.
Yeah. So we'll end up having 2 forms for the 2 time periods, bookending each other. I just need a little information from you guys in terms of what it should say. So when you see it, just where there's text, think about what you want it to say. And I'll create a draft one, and then we can review it and go from there.
Yeah, that is the recommendation, is to assign a return date the day they get their first shot, so that, and put that down on their card that they walk away with. But that's a good idea, to have it all down on paper too.
Yeah, if we just do it in the tool itself, and we do it, even if people call in or somebody's confused, we do it for them. Right. It'll be fine. And then I also need to know if there's going to be a phone number, who's going to be getting those calls and doing those signups.
That would be me, I'm assuming. That's fine though.
And And, you know, there's things you can put in there, like if you have questions, you know, email this email address, etc. But I think we're gonna have to use the form actively on both ends of it, and it should work, but you'll see it when you get the link. I'll send it right after this meeting.
Great.
And hopefully by the time we get to the general population, we'll have Johnson & Johnson or AstraZeneca on board as well.
Right.
And those shots are one.
Right.
So we won't have to worry about this.
Hopefully. But yeah, that's fun stuff. And then when you said decide on clinic type, that's so are we all in agreement on for the first responders, first check with Rutland and then regroup if that's a no-go?
Oh, yeah.
Well,
Say that again, please. Are we all set with what?
So as it was posed for our first responders, those 21 people plus any of Judie's volunteers or potentially the board, if we go through Rutland for those and sign up through them, or do we hold our own clinic for those folks? That was the first kind of decision point I heard.
mhm.
Okay.
And I think Judie's going to check with the Rutland Board of Health, and if they're okay with it, I think that's the most logical approach.
Okay,
If we all agree. And then if
Yeah.
that's a
I
no-go
agree.
from them, we can regroup in our next meeting, which is like, what, tomorrow or the next day?
Next week.
yeah, and setting up a satellite it's just gonna take three nurses, maybe tops, and one person to handle all the paperwork.
And
So it's just 4 or 5 people and we can set it up easily.
regardless of how that goes, like, let's say everybody goes to Rutland and gets we get those 21 plus shots done there. If we can document that and then put it in the same sign up form, so everything, all the data is in one place, I'll be happy to do the data entry for that.
Okay. So you want all if we send them over to Rutland, you still want the names and dates and all that stuff come back to
Yeah.
us? Okay,
I
That
think
way we
that's
can-
very important. It's a very good point, Kate.
We can keep track of everybody in town and kind of know the full extent of it. And that way too, we can, you know, if need be, send out reminders, etc.
okay.
You can also figure out if that type of clinic that they use is going to be efficacious for us, or whether we should adapt it or change it or however, because that's, you know, this is all so new to everybody. I think that we need to take as much information away from that as we can for our use.
I think that's true. Lori, Kate, is putting together the census of the town so that we have a full list of people and age brackets. So we can reach out to people as well once things get rolling. So that information will be coming forth. She's going to put that list together.
Is
As
Mallory
so-
putting that list together, or is it that the town clerk?
That's the
Town
town clerk.
clerk.
Okay.
Since we don't have to have an official EDS drill, I do think if we, whoever we are as volunteers for our own clinics, if we are going to use the elementary school, we should still do a walkthrough. I think Ben's idea of seeing what Rutland does and then coming in and setting ours up based on what Judie you see works well or doesn't work well at the Rutland clinic. We should do our own walkthrough ahead of time before we have actual clinic for seniors or anybody.
Yeah, I agree. We could aim for February vacation, then we don't have to worry about school, and we can do it in the daytime.
Hey, I like that idea. When is their vacation? I'll look it up. I don't have kids. I don't pay attention to that anymore.
Right, yeah.
But
That's
that
Somewhere
usually the
around
week after
President's Day.
Valentine's. Yeah, the week after Valentine's usually.
Okay,
So that'd probably be the 15th through the 19th.
okay. I will be glad to work on supply lists.
Okay,
You said there's some in the trailer too?
there's a lot of paperwork and a lot of paper, pencil, supplies, stuff like that. There's a whole box for that's been sitting there for years. So pens, stuff like that. So, and then there's a cart, and then there's a divider there. But also, we had a donation given to us. So we have box after box after box after box of sheets, flannel sheets. So if we wanted to, set up a first aid station, we have that too, or whatever. So there's a lot of supplies down there that can lend itself to some creativity.
Colleen, do you have access to the trailer? Okay.
No,
I have a key, and Dennis is around down there, so he can open it up for us too.
okay.
Okay.
When do we expect that list of the population from the clerk? Is there,
She was going to work on it and get it to us this week.
that'd be good. I'm not comfortable with waiting till February. I think if this vaccine is available, I think we try to get it as soon as we can. And it may take evenings, it may, we have to identify a place where it can happen. But I think the sooner the better, quite frankly. And especially where we have a smaller population, where we have a smaller population of elderly. I'm saying 65 and older. The early numbers that I saw was somewhere around the 500 or less. I think that's a target population that would work and would be easily coordinated and start off the situation with that. And then we move on after we see how much success it is. But I'm just not comfortable waiting 6 weeks for a start on that. And I think we can do it even if we have to use some of our facilities on a smaller basis. And, I think that's a better way to go.
We did talk about going up to the Hubbardston House.
Hubbardston House would be a great place to start. And
Yeah.
quite frankly, even after 6 o'clock at night, if we have to use the gymnasium, that's also a place. It has limited parking, but we're not going to be doing a lot of people at one time. And that would be actually, it has pretty good parking if we use the main parking lot for sections of people of 25 to 50 a piece, whatever it may be.
Mm.
But I think the more active we can become, and the sooner we do it, the better.
Are the doses going to be available before then, Judy, based on what you've heard? from
For
Well,
senior-
I have to go back and look at the website, because as far as I know, we're only doing phase 1 right now, so I can't remember who all's involved in that. The seniors don't come in until phase 2, and hopefully Friday at the DPH conference, they'll have more information. But there was nothing yesterday. I was a little disappointed.
I mean, I agree. I think we should move as quickly as we can, but until they release until it's available to us, I think we should plan.
Sure, I understand that. And it's very easy to deal with, the delays because of bureaucratic problems that everybody has with these types of things. But I don't think we have to worry about that in Hubbardston. I think we can have our plans ready. I think if those doses come up, we're ready to go and we do it. we're all in agreement here on the committee what we want to do. I don't know if we need to meet continuously. You know, democracy has this problem where it takes time, but I'm not convinced we need to take time on this. I think we just set up a plan and we implement it as soon as we have those vaccines available, and we go for it to just get it done. I mean, I clearly have enough time to help as much as I can. Now that hunting season is over, I guess we're you know, a little bit more available, but I'd be happy to do whatever I can to help this and put this out there and get it done as soon as possible.
That would tying into that, I agree. I think we can move right ahead and start setting up our plans for, you know, the senior clinics and then the general public. But there is a piece that we have to make sure. There was a form that went out, and I know Mallory forwarded it to me, and I got it from about 6 different boards of health. People asking me, what do I do with this? And I said, this is a board of health issue. You guys need to fill it out and send it in, because you're not going to get listed as a vaccine site to be able to receive vaccine until you get that form in. And also you're tied in with MIIS. So there's 2 steps that we need to add to the plans. And one is getting that form in. And we knew, so we need a medical director. And I you know, the medical director is like, it's just somebody, unfortunately, I would love to see it if PAs and NPs were available to be medical directors. But so far what I've seen is that it has to be an MD. And basically they just, you know, you can take the standing orders, which will probably come down from the state, just like the influenza clinics. The state writes out the standing orders. But, you know, the medical director sort of reviews it, says, yeah, they sound good. And then the second thing that medical directors do is they sign off prescriptions. So if you need to order syringes and things like that, those have to come through a prescription. So they just sign that off. Other than that, they do nothing. We basically run the rest of it. So we need to find somebody, a physician, hopefully within town, you know, that would be willing to do it. I do have a couple of names. Stacy Potts works out of Barry Health, and she's agreed to help Rutland and Orange. And then there's another Christina Gracie. She's out of Barry Health. I could contact her, but I also have a new volunteer that just signed on with us, and that's Ann Lipton, and she's been she's an internist, 20 years experience. So she took 1 year off to stay with her kids, but she's getting back in. She's got her resume out there to get back into a work situation. So she said that she would be willing to do that too. So if we can't get Mike's daughter to do it, she might be a good option for us.
Does the MD need to fill in that form, or does the board fill in that form and submit it to the MD?
The board fills out the form and then submits it to the state.
So in terms of action items, Judy, you're going to follow up with finding an MD.
Yeah. I'll ask Ann if she'd be willing to do, or Mike, I'll give him a call first.
Okay. And then in terms of the form, Mallory and Kathy, do you want to take a look at that and fill it in so that we're ready when we have time, when we have it in?
Yeah, because I probably have to sign off on it anyhow.
Yep. And then the MIIS thing we're already on. That's good to know.
Yeah. Now, Mallory, did you find out who was on that list? I mean, you said Sandy.
Yeah, it was Sandy and then Andrea, so I'm still working with getting everything switched over to us. But I'll send you the link, Kate, so you can apply, and whoever else wants to apply. Andrea was the administrator, and then Sandy was on as well.
Well, Sandy's going to be tied in with she's on the
I'm
Fitchburg. Yeah, Sandy's on the Fitchburg Board of Health, and
Yeah.
she's also doing several towns for Maven. So I don't know where she would stand with all of this.
Okay.
And I would say, I know we all love to read very lengthy documents. So I would say now is the time for everybody on the board to become familiar with the portions of the EDS plan that we're going to need to execute on if we're going to try to execute quickly.
Yeah.
Good point, Kate.
What is that, chapter 3 or something?
It's in there. I say it's only 167 pages. You guys can handle it.
To address Ben's suggestion of doing walkthrough ahead of time, are schools closed for Martin Luther King's birthday on Monday, the 18th?
Yes.
Could we do a clinic that day or a walkthrough that day at the elementary school?
Okay, that sounds good.
We can do a date. We can do a daytime one.
Yep.
What does that day look like for everybody? Figure an hour and a half.
Me.
I'm free.
I'm free.
I can be free.
Well, what time do you want to do it?
What works best for you, Kate?
Doesn't matter. I've gotten carte blanche from my company to take whatever time is needed for this.
Woohoo!
I am not free between 11:15 and 12:15. I can't do it between that 1 hour.
Sure.
Like say 1 to 2:30.
Sure. Let's try 1 to 2:30. Is that
Yep,
too
that's
close
good.
for you,
That's good for
Colleen?
me. Yep.
And I'll get a hold of Jamie and I'll tell her and ask her if she's available so she can come down and update us on all the DPH stuff.
Perfect.
All right. I'll contact the principal and let her know that, we can do it on a day when no one's there. So I just, because I can't remember things well. At one point, we had a selectman on board that was a physician. Is he still on our board?
That's Mike's daughter.
Is Mike still on?
No,
He's off. Okay. But he is a resident of town. So
Yep.
I want, he's maybe someone to reach out to.
I will. I'll call him.
Okay.
So right now, I've been writing a list of to-dos here. So we're going to continue to work on the sign up thing. Katie's involved with that, right?
Yep.
And then we have checking in with Rutland and kind of finalizing, getting our folks to go over there and finding out if we need to do a backup over here. Third is still getting the census from Lori.
Right.
Fourth is checking and getting the supply list and taking a look at what we have, and Kathy was going to do that, and Colleen and I will try to get down and into the trailer.
No, that's okay. I'll get into it. It's fine.
Okay, you'll get into it. All right.
Yeah, you got your hands full. I can handle list stuff. I'm very good at that.
Do you want me to be there with you, Kathy, or?
If you want to, yeah.
Yeah, no, I'll come down. I just don't have a key or anything to get into the trailer, so
That's okay.
Dennis would have to,
Sure.
probably get down and help us out.
Yep.
Actually, now,
Yeah.
remember we were talking about this and we were talking about all the snow? So this would probably be a really good time in the next
Couple days.
few days, or there's no, I mean, I think it'd be easily accessible now.
Yep.
Yeah. Versus 18 inches.
Yeah.
Okay.
Yeah, we'll talk afterwards, Colleen, and set it up for sometime this week.
Okay, that sounds good.
And then the EDS walkthrough, we'll get a hold of Jamie for the 18th, sometime between 1 and 2:30.
Yep.
And then the next one is to go back out on the website and see if we can pin down as much information from DPH on phase 1, phase 2 plans. And then the last one is, as Kathy said, get a hold of Mike. And if not, then I'll talk to Ann Lipton and see if she'd be willing to do it.
Right,
One more action item
for
is
the application. We gotta
we
get
need
that
to-
application in, yeah,
we need to sign up for training in the MIS.
right.
Okay, training.
Do we need this group of things to be done before the first responders go? Or can they go before all this gets taken care of?
They can go before.
Okay, so we need to set a date for them to go then.
Right, well, yeah, I'll talk to Rich today
Okay,
or tomorrow.
so that'd be the first responders and any volunteers that we know of, so we don't exclude them.
Right, right.
And I'm
Probably
assuming,
folks who have been on, way back when I first got on the board the first time, I had, I developed a local list of nurses from the town. And that's how I got into, that was our first step, and then eventually morphed to the MRC. So I still have a number of those nurses, Lois Tyler, Kathy Araldi, so those folks are all, they'll jump on board right away.
would you send that list of people that are Hubbarstonians to Kate and Mallory, because they're gonna do the data stuff, so they need to know those names.
So you want to get them trained. Okay, that's not a problem.
If they're gonna be volunteers, that should be part of it. I'm assuming that each of us on the board and Mallory are gonna volunteer to help with these clinics. We're all participating in the meetings. So am I correct on saying that? So then there's 5 of us plus
Yep.
and Mallory, so that's 6.
Yeah,
And
I mean, there's screening when you first come in. There's somebody
Sure.
that needs to screen
direct
immediately when you
traffic,
first
all
come in.
kinds of stuff. Yes.
Yeah, and then there's registration, and then there's people, we just need folks to point people where to go as well. We need monitors after they get the shot because they can't go anywhere for 15 minutes. So there's all kinds of stuff that's not nursey.
Right. Yep.
So, Judy, I have a question, or anybody. On my calendar here, I have on the 11th, we were supposed to go to the Hubbardston Center School
Yep.
at 3:30. So we're not doing that
That's
on
off.
the
That's
11th.
canceled.
Okay, so that's really going to happen on the 18th. Okay,
Correct.
all right. Just want to make sure because I had it written down in my schedule book. I still use books, sorry.
So do I. Paper backup for everything.
That's right.
Right.
And we have Kate to back up the board.
Yeah, I don't
Yeah.
screw or anything.
In case our
right.
pens run out of ink.
No, my Apple pen doesn't ever run out of ink.
Oh, whoa.
It works like magic. It just.
So
Right.
that's the last item. That was number 8 on my list, was everybody getting training and with MIS and PrepMed or whatever they call it.
Yep.
The new-
Good, good.
Okay. All right. And number 9 is forward a list of nurses from Hubbardston that
Right.
have already been quarried and everything else.
Right.
Of course, you can't get a license without getting quarried anyway, so. Kind of redundant. All right.
Look at that. Anything
Anybody
else?
else
No.
have questions?
We want to set a timetable for, not to put any pressure on you, Judy, but anything, do we want to have an answer for some of these questions by a date?
Well, I can update you next week.
So we have a Zoom meeting, our regular Board of Health meeting on Tuesday, the 12th. So maybe we can set that as our target date.
Okay.
Okay,
You mean January 12th, of course.
January, sorry, jumping ahead.
We have nothing else on the agenda?
Nope.
Motion to adjourn?
So moved.
So moved. We always all agree on adjournment, so I'm not even gonna.
I do have one more question before we adjourn. Kathy, when are we going to talk about going to the trailer?
Let's see.
You want to just decide that now?
Sure.
'Cause-
Tomorrow,
Okay, tomorrow's
What's-
good.
okay. How about 11 o'clock?
Okay. Is that, will Dennis be down there, Judy?
no, I won't be awake.
Dennis won't be awake?
Retirement, what can I say? He'll just be on his first cup of coffee.
My kind of guy.
Well, are you serious? Should we do it later?
Yeah, I would suggest you do it later.
How about 1 o'clock?
Okay,
Yeah.
1 o'clock. Yeah, 1 o'clock's good for me. I'll be on my third cup of coffee at 1 o'clock. So, and it will be an iced coffee. All right, 1 o'clock tomorrow.
And we're gonna meet
Tomorrow.
at the trailer.
Right, so I'll let him know.
Okay.
And
Yeah,
that is
He's
down,
there today. He's there today, just left for work.
so that trailer is located where?
At the highway department, and it's
Is
off
it-
to the right.
Okay,
You can't miss it.
got it.
If you're at the highway department, you can't miss it.
Yeah, it's an 18-foot, the regular tractor trailer.
Oh,
No, it's a pull trailer. It's not
I
a
am-
tractor
Well,
trailer.
there's two of them now. We don't, the board, emergency management owns two of them. We have the smaller pull trailer, but we also now have a very large one, which is a full-size trailer that you would see on a tractor trailer setup. And we've transferred a lot of the stuff into the larger trailer because it's now safer. And the old trailer we had, the mice could get into it, but now this one's totally sealed off. It is much better. It's got shelves and all kinds of stuff in it now.
Is it on the ground or is it on an actual flatbed and you have to get up in and out of it with stairs?
No, it's on the ground.
Okay.
Yeah, they said that the town got 3 of them and they laid out foundations, and so it's on the ground and it's just a simple one step into it.
Okay. That's good.
thanks,
You'll like
Colleen.
it when you see it.
Oh.
Sounds great.
Can't wait. Just can't wait to get in there.
Yeah, but you'll like it because it's, like I said, it's got shelves and everything else
Yeah.
in it. It's really nicely set up.
Okay. A question though. So is there a door on the side of that trailer also?
No.
Or is it just a back door?
It's
So
just
are we,
one
we're
door.
gonna,
It's just a box and it's just a door, one door in.
okay, so we're probably gonna need a couple of lights.
Yeah, if you go
Flashlight.
during daytime, no.
No,
There's-
it has
there's
the,
enough light. Yeah,
it
there's
has,
enough light.
it doesn't have a, the roof is not
No,
metal.
it doesn't have any in the
Okay.
roof, but
Okay.
it's
Just
been-
wondering, I've been in many tractor trailers in my life, so it's like, I know that this could be a problem if there's no light in there
Yeah.
because
Right.
it's gonna be pretty dark unless we have a side door to open also.
Right,
Usually on the big ones, they don't.
yeah.
Okay,
And most of the Board of Health stuff is toward the front, toward the opening, so
oh, good, okay.
it'll be
All right.
easy enough to find.
I'll still bring my headlamp,
Okay,
my
I'll bring a
trusty
flashlight
headlamp
too. Yep.
or flashlight.
all right. I can't be there because I have a doctor's appointment tomorrow in Worcester, so
Okay,
they want to look at my eyeballs, eye doctor appointment. So, other than that, that's it.
Okay. So I'll see you
Awesome.
tomorrow.
See you tomorrow, Colleen.
All right. Bye, guys.
So we got to
Bye.
officially adjourn.
Yeah,
Yes,
we're gonna
move to adjourn.
officially. If I had a gavel, I'd bang it or something.
Yeah. Okay.
Move to adjourn.
Move to adjourn. So.
Thank
so
you.
second.
There's a second.
I'll second.
3 seconds.
All in favor? Aye.
Aye.
Of vote.
All right. We'll see you later then.
Okay. Bye, everybody.
Bye.
Thank you.